You've been prescribed insulin injections in order to help control and manage your diabetes. The type of insulin and the dose is something you will discuss with your healthcare team. This video will demonstrate on what you will need in order to inject an insulin injection correctly. So before giving yourself the injection, ensure to wash and dry your hands thoroughly. Next, you will need your insulin pen device. This is likely going to be a disposable device, although some insulin is available in a cartridge, which is inserted into a reusable pen device. For the purpose of this demonstration, I will be using a disposable insulin pen. The disposable pen already contains insulin. Some insulins are clear in appearance and some are cloudy. If you have been prescribed a cloudy insulin, you will need to gently mix the insulin by tilting the pen back and forth a few times. Next, you will need a needle. The needle is small and thin, and the insulin needs to be injected underneath the skin, not into a muscle or a vein. Decide on your injection site. The main sites are in your tummy, below your belly button, on the upper sides of the thighs, and on your bottom. It is important to try and use different sides every time you inject. You should try and leave at least a centimeter gap between each side, otherwise hard lumps called lipos can form, and these will stop the insulin from being absorbed properly into the body. Next, you need to attach your needle onto the insulin pen. So take your needle and then you peel off the end and then you attach it onto the pen. You can do this by pushing and twisting the needle onto the pen and then continuing to twist until you can go no further. Once the needle is in place, remove the outer clear plastic, then carefully remove the needle cover. Before giving the injection, dial up 2 units on the insulin pen, push the plunger upwards, and you'll see a small amount of insulin being injected from the needle. This will ensure that any air has been dispelled, the needle is primed, and that the pen is working correctly. Now you will need to dial your dose. Do this by dialing up the number of units that you have been advised to take. Whilst doing so, you will also hear a clicking noise on the pen. In most pens, each click corresponds to 1 unit on the pen. You will see the insulin being dispensed from the dosage window. You are now ready to give the injection. Ensure that the area that you have chosen is clean and dry. You do not need to pinch the skin as the needle is very small and therefore does not need to go in too deep. Insert the needle in a 90-degree angle. Press the plunger all the way down in order to ensure that the dose has gone all the way back down to 0. Then you count to 10 to allow the insulin to enter the body. After the count of 10, remove the needle from your skin. Your insulin injection has now been administered. All that is left to do is to dispose of the needle. To remove the needle from the pen, take the clear plastic needle cap, not the smaller white cap, place it on top of the needle, push down and twist off. Once removed, place the needle into the sharp spin. These can be obtained on prescription from your GP. Remember to dispose the needle each time you have given an insulin injection. With your ongoing prescription of insulin from your GP, you'll usually be dispensed 5 boxes of pens. The pen you are currently using to inject should be kept at room temperature. Any other pens should be stored in a fridge until they are ready to be used. The insulin pen stays at room temperature for 4 weeks, so it is always good to make a note when you start a new pen. If you have not used all the insulin in the pen, after 4 weeks, you will need to dispose of that pen and start a new one.